Well, good morning all, and today I'm joined by Dr. Mark Veitch, Director of Public Health, and Dale Webster, Acting State Health Commander, and Donna Adams, the Acting Commissioner. So good morning all, good morning Stephen, and today I will provide an update on the COVID positive case and the vaccination program as well. The young person who was confirmed as COVID positive on Saturday is still clinically well. He remains at the Fountainside COVID Case Management Facility in Hobart and is undergoing regular health assessments. The young person's father is also located with his child at the Fountainside Quarantine Facility. As advised yesterday and prior to the positive test result, the young person did leave home quarantine on Saturday the 2nd of October and travelled with a family member to the IGA Express at 113 Georgetown Road, Newnham. Whilst the pair were only at the shop for a few minutes, out of an abundance of caution, we have declared the IGA as an exposure site with an exposure window between 2:20pm and 2:45pm on Saturday the 2nd of October. Public Health has used Check-in Tas data to connect those who visited the supermarket between these times. However, if anyone has concerns they may have been at the IGA during the exposure window, please self-isolate and contact the Public Health hotline on 1800 671 738. To date, associated with this one positive case of the teenager, including passengers on the plane, close family and workers at the airport, there have been 17 primary close contacts and 35 casual contacts identified, and all 17 close contacts are in quarantine. 9 primary close contacts have returned negative test results and the remaining results are pending. All tests from close contacts have returned negative results so far. I'd also like to emphasise that there is no ongoing risk at this particular business. I've reached out to the owners, or indeed the manager of the IGA in Newnham, and as I know Business Tasmania has as well, to discuss what support is available to them or may be required. When it comes to testing, it is vitally important now that we monitor the community for any signs of COVID. It is important that anyone in the Newnham and wider Launceston area get tested if you experience even the mildest symptoms. Testing hours have been extended at the Launceston Clinic. The Wellington Street Clinic has extended hours from 8:30am to 5pm and has additional capacity. Tests can be booked online at coronavirus.tas.gov.au or again by calling the Public Health hotline on 1800 671 738. In terms of testing numbers, 510 tests were conducted on Saturday, 499 on Sunday and 740 yesterday, that being Monday. Can I thank all of those that have come forward for a test, and please, if you have any symptoms, again, even if they are only just mild, I encourage you and urge you to get tested. In response to the recent positive case, an additional 12 wastewater testing sites have been added for Launceston and surrounds, and we will be testing these extra sites for the next 2 weeks. Clearly though, the situation shows that while using the Check-in Tas app and being COVID safe are just so very, very important. Using the app helps Public Health contact you quickly if you have been at an exposure site. There have been over 57 million check-ins in Tasmania across over 32,000 venues, and it is important that we continue to check in every time and be COVID safe. Keep maintaining a physical distance, wear a face mask where required, cover your coughs and sneezes and observe restrictions and safety plans are in place. Stay at home if you're unwell, and don't hesitate to get a test, even if it's just a sniffle. Tasmanians are continuing to roll up their sleeves and come forward for vaccination, and I thank everyone for that. We now have 77.5% of Tasmanians aged 16 and over with 1 dose of the vaccine, and this weekend we've passed the important milestone of 60% of Tasmanians that have been fully vaccinated. However, this means that we still have around 100,000 Tasmanians aged 16 and over who haven't had a COVID-19 vaccine. And to these people, I would say, please make your vaccination an absolute priority to protect yourself, to protect your loved ones, and to protect the community. The message is now very simple. Anyone aged 12 and over can get vaccinated at a GP, at a pharmacy or a state-run community clinic. And over the next 6 weeks, there are thousands of appointments available throughout the state at these different vaccination providers. So my message could not be any clearer. Don't wait, vaccinate. And now I'll hand over to Dr. Veitch to say a few words. Thank you, and myself, Dr. Veitch, Mr. Webster and Ms. Adams will be available for questions.
Thank you, Acting Premier. I'll just make a couple of comments and then be happy to take questions. Firstly, I'd like to confirm that the laboratory advised me this morning that this was characterised as a Delta strain infection as we expected, it being the predominant strain in Victoria where this was acquired. The second thing I'd like to emphasise is that even if you've been vaccinated, 1 dose or 2 doses, and you've got a sniffle or cold or flu symptoms, please go and get tested for COVID. We know that COVID infection can occur in people who've been vaccinated. We know that it's usually much milder and much less likely to result in people ending up seriously ill, but you can still get a mild infection after having been infected. So don't take being vaccinated as meaning that you don't have to get tested. And finally, on the matter of vaccination, I really want to emphasise that that's just so critically important that people go out and get vaccinated. If you've had your vaccine, talk to someone else you might know who's perhaps not had their vaccine. Help them along to get their vaccine if they need transport, or point them towards the information and advice that you found helpful in making your decision. So even those that have been vaccinated can help those two ways. They can get tested if they get sniffles, and they can support and advise people how to get vaccinated if they've got a family member or a friend who's not quite across the line yet.
There's no evidence of this case having led to any further cases. How long will it take before you are satisfied that there has been no further spread?
Well, there are two things that we're principally concerned about, is whether or not this case has spread infection to their close or casual contacts. It's much more likely to occur with the smaller circle of close contacts. Those close contacts will have one test now, they'll have another test probably towards the start of next week, and a test in between if they get any symptoms. So it really requires us to wait 12 to 14 days, which is probably to the middle of the month, till we know that the close contacts are clear and the casual contacts too. So it's probably about the middle of the month, but we'll be firstly looking at the close contacts. That gives us an indication of how infectious this person was to the people who are close to them. We'll certainly be keen to know that the casual contacts haven't been infected. That's going to take around about the same time. And of course, we want people in the Launceston area to go out and get tested in numbers over the next fortnight to give us absolute reassurance whether or not this infection has reached the wider community.
When did Public Health learn that the boy had broken quarantine and attended the supermarket? Because the supermarket owner, I think, has said that she learned of it on the Monday. So when was it that Public Health learned of it?
I think through Monday, yes. Yes, we learnt about it on Monday morning.
And that would have been through what, further questioning of the boy and his family to sort of check movements?
We had a conversation with someone who suggested that this may have occurred.
We've heard from one of the IGA employees that the boy was riding his scooter around the supermarket. Do we know if he rode the scooter to the supermarket, and did he interact with any other people through that?
I assume he rode the scooter to the supermarket. And we've had a close look at the video footage. There were actually very few people in the premises at the time. Any contact that he had with people in the premises at the time that he was there was really fleeting. So that's why we've declared all of the people who were at the premises at the time as casual contacts. That means they have to stay in quarantine, get tested on day 5, and at that stage we will make a decision whether or not they need to stay in quarantine or can be released.
How confident are you that the boy didn't go anywhere else before the supermarket or after the supermarket or that he's positive result?
We have had multiple discussions with the case and his family, and as in all of COVID, we can only go on what we're told. And based on that, we believe we've heard what they said they did, and that's the limits of our knowledge. It's always the best you can do. We certainly have CCTV to understand his movements at the supermarket. We know that not too long after he came back from the supermarket, he would have received a call and then a number of calls and conversations with our contact tracers, because that was the point at which the diagnosis was conveyed to him.
Do you have a statistical idea of what the likelihood of another COVID case arising from this case would be?
The likelihood of a case amongst close contacts, or at least one of the close contacts, I think is quite high. The people who he travelled with from the airport, his father, the relatives with whom he interacted before his diagnosis was known, he spent quite a time quite close to them. So I would not be surprised if we get a case amongst them diagnosed either in the round of testing that we're doing at the moment, when that's complete, or in a subsequent round of testing.
How's the father's condition at the moment? Is he still well?
I don't have details on the father's condition. I have no reason to believe he would be unwell.
Now, I understand he wouldn't have been able to. The father obviously had been not in Melbourne, and when the boy arrived home, the father would have been able to freely move about. How much detail do you have about the father's movements?
We know considerable detail about the father's movements, but then he posed no risk at that stage because he'd only very recently had contact with his son, and some people take more often than not 48 hours or longer to get infectious. Sometimes it can be a bit sooner, but there's no reason to believe that the father posed an infectious risk in the first day or so after the son came home.
And how likely is it that the father will now contract?
I've kind of answered the question generally, that your likelihood of getting infected depends upon how long you spend, how close to people. And within households where there's a case of coronavirus, it's very common to have cases in those household members.
It may not be directly relevant to this case, but does this raise in your mind any need to expand the use of the Check-In TAS app to younger people?
It's a good question, David. We know that some young people will have mobile phones and will choose to use the app. I think it's difficult to force the use of the app on people. Alternatively, they can check in, and some young people do voluntarily check into places that that require check-in. But it hasn't been. We haven't. It's not an active consideration, but it's not an unreasonable thing for us to consider as we go forward.
This exposure site is in a community which has a lower vaccination rate than some other parts of the state. It's a very multicultural community. Is public health, I suppose, considering all of these unique factors of this community as a response to this? Do you need to take any special actions here?
We're particularly focusing on the close and the casual contacts, because that's really where we need to target our interventions at the moment, and I think that's been well managed by my colleagues in the Public Health Operations Centre. I think when we talk about communities that have got multicultural characteristics, may include pockets of people who are relatively disadvantaged, the really important thing there relates to vaccination, and our vaccination program is mindful of that, and sets up clinics to try and reach out to people in those settings. I'd probably have to leave that to the state vaccination commander, Dale Webster, to provide more detail on the particular things that are being done.
Is there more concern about an outbreak in Launceston and Unum, though, considering the low vaccination vaccination rates?
Unfortunately, outbreaks can occur until you get your vaccination coverage up very high. So even those parts of Tasmania that enjoy relatively high first and second dose vaccination coverages are currently at risk. And that's why we need to really push the message for everywhere statewide to get vaccinated. If there is any increased risk in a place with a lower vaccination coverage, it's only a bit less than places with the risk is only slightly higher than places with better vaccination coverage, because at the moment nowhere in Tasmania is quite at the level that the vaccination coverage would stifle the spread of an outbreak.
Does this incident cause a reassessment on whether home quarantine is a good option while less than 90% of the population is vaccinated?
We constantly review border measures and the quarantine measures that are applied to people who cross the border. And it's correct to observe that at the moment we are concerned particularly about the rising rates of COVID in Victoria. So quite the right way to manage that at the border and within Tasmania is something we're continuing to review. And you'll have noticed that yesterday we added Manningham, Stonington and Maroondah as local government areas in Victoria that required a higher level of quarantine should people be allowed to come in.
Just a quick question on the Garvan Institute modelling that's being done. Obviously there's been more research done since the Doherty modelling was done around the effectiveness of the vaccines in preventing transmission. Will the Garvan Institute modelling be taking into account those latest findings that have happened since the Doherty modelling?
When you develop a model, and I might just add that the team that's going to be doing the modelling will actually be coming out of the Kirby Institute for Infection and Immunology rather than Garvan. That's been it's the same people, but it's just going to be coming out of Kirby rather than Garvan. When you set up a model to see how many cases you're going to get when you run your model, you have inputs that you put into it, and they will be putting inputs such as the level of vaccination, how effective the vaccination is at preventing hospitalisations and deaths and intensive care admission. That's really important for modelling the hospital outcomes. They'll also be putting into it estimates of the extent to which the vaccine prevents transmission, as you ask, and we know that's less effective at preventing transmission than it is at those severe clinical consequences. But the models will put the latest values in. They'll also put values a bit higher and lower just to see how that changes the picture.
I've got a question from the Deputy Secretary.
Do you know roughly as a percentage how much of Newnham and Launceston are vaccinated?
Look, generally in Launceston it's around it's low 70s, and Newman's slightly behind that in the high 60s. And the areas of warning that we take are those that are below the state average, which, as the acting Premier said at the moment, is 77.5. So when we talk about it's lower, we're talking about it's lower than that state average. And so we put in some effort to actually try and get that up to the state average and keep it rolling.
When you say 70 and 60%, do you mean that's of first dose or double dose?
Yes, I'm talking about first doses with those. Yeah.
And what do you know about why that figure is the way it is, and how are you trying to lift it?
So what we know about how that figure is a number of things will come into that, and some of that will be hesitancy, some of it will be access, some of it will be literacy issues. So what we're doing with that is, it was identified earlier about the large culturally and linguistically diverse population in Newnham and surrounding areas. So we're working with the Migrant Resource Centre North and with MCOT across the state and running information evenings and vaccination evenings that are actually being translated into a number of languages so that people can get the message in their own language and hopefully better understand it. We're also working with local community organisations. So the Neighbourhood House were very prominent in our program at Risdon on the weekend, for instance. The program we're running today at Claremont is being supported by the RSL. So we're working with the local community organisation that can help us get to people. And it is about making ourselves accessible. So we've got our mass clinics running in CBDs, and then we've got our, smaller pop-up clinics running in local areas so that people can literally just walk down the street and come to a clinic.
That area does have a lower level of car ownership, and public transport links are not always perfect there. Can people get tested in that community, or do they have to go all the way into the CBD in Launceston?
So the testing clinic is in Wellington Street in Launceston, the main clinic. So that's where they go there. It is on a bus route as well. But in addition to that, if they ring the public health hotline, there is of course the respiratory clinic in Launceston, and it may be that they're able to be do a test through a GP as well. So again, if they have problems getting to a testing clinic, it is important that they reach out to us on the public health hotline, and we can organise something.
And presumably vaccination is available through pharmacies in that area and GPs, but are there vaccination clinics in that northern suburbs area of Launceston, or will there be as a result of this?
Yeah. So this Friday and Saturday there is a clinic, a pop-up clinic in Invermay on Mowbray Road, which is available for bookings right now, and we'll take walk-ins later in the week when it occurs. So that's the third time that we've had a pop-up clinic in the northern suburbs, and we'll continue to do that as we make sure that the state average is actually an average in every local government area, not just across the state.
With the difference in vaccination rates between local government areas that we're seeing, what do you think is explaining the differences that we're seeing?
I think there are a number of inputs there, David. I think that one of them is literacy levels, and you have to go online to make a booking, or and the system requires you to do certain things. So that's why we're reaching out through community organisations who may be able to actually help people make the booking, or indeed in some of these small pop-up clinics having walk-ins, so people don't have to go through that process of getting a booking. I think the second is some hesitancy. The early media back in April, May, June probably didn't help people's confidence levels. But the third thing is the accessibility issue. Not being able to get into a CBD clinic or in from a rural area, which is why it's really important that part of the process now is actually getting out to those areas. And we've had pop-up clinics in a number of areas from Sheffield to Risdon Vale just in the last 2 weeks.
And how are you seeing the rates of bookings? Are they staying steady or increasing? Or?
As you'd expect, when we're getting up to the high 70s, the bookings are tailing off, but we still have a lot of appointments, and we'll continue to put the appointments in the book to make sure that every Tasmanian, up to 100% of Tasmanians, can actually get a booking, and so that when we say everyone's had access, we can be confident they've had access. So I would encourage people to actually continue to book, to continue to go to their pharmacies, which are now, in the local area with Moderna, the participating GPs. But the important thing is that on Sunday, when we made the call for walk-ins at Launceston, we got over 100 people come straight away. We're doing walk-ins in Launceston today, so already I had a look before I came in, and about 100 people have turned up already. So we want to continue that access by the booking or walk-in as we go to get that, ideally get it to 100%.
Do you have a sense of when that might happen? If there's 100,000 people who are eligible still to get the jab, do you have a sense of when you might be able to say, well, I'm confident that everyone who is eligible has had an opportunity to?
Look, I would say to you that that's going to be sometime in the next few weeks. Everyone will have had the opportunity. But what I would say to you is we'll continue to have clinics beyond that point, because until we've got to, I shouldn't say 100%, until you got 100%, you keep offering it, basically.
And do you have a sense of what percentage is achievable over time with this vaccine?
Yeah, look,
these vaccines?
I'd be very confident that we can get into the 90%. And as the Premier has already said in previous conferences, aiming to do that by the early December.
I might move to questions if anyone has any for the Acting Commissioner.
First and foremost, the response at the moment is a public health response. Once we know that this young person has recovered from his illness, we'll review the circumstances surrounding the quarantine breach. It's important that everybody is aware that the youth justice provisions is important consideration in how we review the particular circumstances surrounding him leaving his premises, and that's around diversion rather than the criminal justice system.
How concerning is it to see someone flaunting quarantine restrictions?
I think it's important that we put this in context. Since the 1st of January this year, we've had over 13,000 people in home quarantine. And during that time, we've had one breach which has been subject of a fine. So I think it's important that Tasmanians understand there is a high level of compliance in terms of home quarantine.
We'll move to other issues for the Minister.
Just a question on this COVID situation. Is there still state financial support for casual workers who have to stop work to get tested and isolate, like in this situation?
Well, as I said, I've reached out personally to the business today and spoken to the manager to see how they are, the welfare of the owners, and indeed also the staff as well, which is very important, given the anxiety that they may well be experiencing prior to their test results coming back. In terms of the business, can I commend the manager of indicating that, of course, they will support their casual workforce in the interim. But Business Tasmania has reached out to the individual business. I've reached out to the individual business, and of course there will be support available should that be requested to support the business through what I know has been a very difficult time over the course of the last 24 hours.
But just to clarify, is the program where there's a payment for workers who have to miss work to get tested and isolated, is that program still operating, or is this being done on an ad hoc basis now?
Well, if we would like to be consistent in what we have applied in terms of our support previously. I know in terms of business support, my understanding is around $2,500 has been available previously to individual businesses. We want to be there also to support the individual employees. So consistency of what has been in the past should absolutely apply in this case.
The store owner has offered to pay employees for missed shifts. Are they likely to get reimbursed for that?
Well, I would firstly thank you, and that's terrific to see in terms of an employer reaching out and supporting their staff, as they should. And we'll be there to support the individual business, given their personal financial circumstances as a result of their impact in the course of the last 24 hours. And we're open through Business Tasmania to support the individual business as required.
Looking at Facebook comments in response to this case with the 15-year-old, a lot of people are saying, oh, bloody teenagers. So how would you assess the effort of young people in Tasmania more broadly around COVID? Are they all irresponsible?
Well, what is important, there's been a great deal of compliance of the entire Tasmanian community, including our young people. And our young people, the feedback that I get from our young people was that they're very concerned about the pandemic and what that might mean for their future, my children included. And so I can commend all Tasmanians, including our young people. We have had a tremendous response to the pandemic. In my own home area of the northwest coast, remember, we went into the most severe lockdown that Tasmania has experienced more than 12 months ago, and everyone did such a tremendous job of following the rules and applying COVID-safe behaviours. And the great and huge majority of Tasmanians apply those COVID-safe behaviours and do exactly the right thing. And we don't want to put labels on people or indeed various sectors of the community. We're all working together to ensure that we can keep everyone safe, and as the Acting Commissioner has just highlighted when it comes to home quarantine. One breach all year, but some 13,000 people have home quarantined. So that demonstrates to me that people largely are following the rules as they should.
Emily Baker's reported today on the fact that a Tasmanian teenager was removed from the Many Colours One Direction program in the Northern Territory because child protection officers here overheard the operator of that program swearing at the child and referring to them as an expletive idiot over the phone. What's your reaction to that?
Well, firstly, my understanding is that the Department of Communities have assured that all the young people at the MC1D are safe, and of course it is reviewing the matter, and indeed you will be very well aware that the Tasmanian Government's decision back in July, where they accepted the expert panel's recommendations to transition away from the program, and there's been no further placements in the program since the investigative review was announced in October last year.
So why is it that other children are staying in that program when the department has evidence that the caregiver is swearing at them?
Well, my understanding also is that each of the young people at the program has an individual transition plan in place for their return to Tasmania as appropriate, and to ensure that all supports necessary are provided to them to ensure a safe and stable transition. And of course visits by child safety and family members are scheduled in coming weeks as part of those transition plans.
We've seen Martin Goddard release data today saying the national plan is too optimistic and it was not based on the Delta variant being highly transmissible. Is that being taken into account with this new modelling that we're awaiting?
Yes, well, I've received Mr Goddard's report, and we have received a lot of commentary from Mr Goddard over time, and I'm absolutely, of course, willing to engage with him, but as has already been pointed out, we're doing our own Tasmanian specific modelling to understand the health system requirements for Tasmania under various scenarios in terms of surge capacity, restrictions, vaccination rates, when we reach that 80 to 90%, for example, very specific to Tasmania, that will inform us when we make some very key decisions when we get those vaccinations rates at 90% or above. And indeed, of course, the most important thing, as Mr Webster pointed out, that the Premier has pointed out many times, is that every single Tasmanian has had to have the opportunity to be vaccinated. So there are various scenarios that Professor McIntyre is modelling through the Kirby Institute, and we look forward to receiving that modelling. But you know, Mr Goddard's interest in the matter is also appreciated.
When we receive that modelling, what will be the number of projected deaths or illnesses the government will see acceptable in the reopening of our borders?
We'll wait until we receive the modelling, and you know, loath to accept, and we don't want anyone dying from COVID-19. We've had 13 tragic deaths in Tasmania over the course of the last 20 months, which has rocked this community and devastated loved ones. So, and all the modelling and all the decisions that we make, all the public health advice that we receive will all be about maximising every single effort to prevent COVID-19 and ensuring that the safety is the number one priority. Safety of all Tasmanians is the number one priority.
Some data was released this morning about the impact of border closures and so on the Tasmanian tourism industry. It showed a 30% drop in expenditure within the state with those tourism businesses. How much does I suppose the health of that industry, which obviously employs a lot of Tasmanians, how much does that factor into the government's decision making around COVID?
When it comes to the government's decision making and how we might support businesses, will be the key priority in that sense. And I empathise with the businesses that have been so dramatically affected over the course of the last 12 months. Border closures have an extraordinary impact on individual businesses that are involved in particularly the tourism and hospitality industry. We've reached in to support those businesses in the past through various measures and doing whatever we can. We all want to see life get back to as normal as possible post the pandemic, but it'll be here with us for some time. So the decisions we make are, number one, the safety of all Tasmanians has to be the number one priority. And that does affect an impact on individual businesses. Then, of course, we need to make decisions and quite rightly engage with those affected at how we can support our local economy and indeed our businesses to get through what I know has been some extraordinarily challenging times. Thank you.
Thank you.